Behavioral activation is effective. Researchers have found that it's more effective than techniques that address our thoughts, and it's on par with medication when it comes to treatment for depression. So, what is behavioral activation? Behavioral activation is a technique that addresses a person's behavior. The goal is to increase activity levels, especially those that are positive and reinforcing. Let me explain why this works to treat depression. Someone who's depressed will often lose their motivation to do activities, even things that they used to enjoy. They might stop exercising, they'll call friends less frequently, and they'll put less effort into their work. All of these changes have bad consequences, such as worsening health, fewer social interactions, and worse work performance. This reduction in positive experiences and increase in negative experience is the beginning of a cycle that leads to the depression worsening. Behavioral activation stops the cycle by getting someone to do positive activities even if they aren't that pleasurable for them at first. Like we talked about before, a person's motivation is pretty low, so it's challenging, but it becomes easier once the cycle has been broken. Next, how do we actually use behavioral activation? First, we need to identify the negative behaviors that prevent a person from doing the positive behaviors. This could be anything from sleeping too late, using drugs, or maybe just actively avoiding friends. You'll also have to come up with positive behaviors to replace the negative ones. These could be as simple as waking up early and going for a walk, or maybe calling a friend. When you're just getting started with behavioral activation, you don't want to do anything too tough. You don't want to lose motivation and not follow through. So these activities should be easy and rewarding. After some time, the challenge of these tasks can and should start to increase. Maybe progress from calling a friend to actually going out with a friend, or maybe starting to send resumes or applying for a job, these sort of long-term positive activities. Remember, these are just examples. Real life can be a lot more confusing and a lot messier. A therapist can help to identify these more complex negative behavior patterns and maybe help someone come up with ideas for realistic positive replacements. Next, it's important to come up with a specific plan to begin making these changes to behavior. Simply saying, I'm going to wake up tomorrow morning and go for a walk isn't really enough. Remember, depression destroys a person's motivation. Even a task that seems simple isn't always that simple. One good way to create a behavioral activation plan is to schedule out an entire day. Now you have to be easy on yourself. Don't schedule difficult activities from sunrise to sunset. This might mean just picking a few simple but rewarding activities sprinkled throughout the day. Of course, the final stage is to actually implement the plan that you've created. It's easier said than done, so let me give you a few tips to make it more likely that you're successful. Keep the changes simple. A small change is definitely better than no change. Someone who is depressed might feel like they need to force themselves to do even the simplest tasks they've planned for. That's okay, that's normal, that's what depression is. If you fail to follow your schedule, just try to get back on track for the next activity. Social support is really important. A therapist should ask about a person's success with the behavioral activation plan every session. Better yet, someone who is trying to follow a plan should try to tell a loved one and ask them to check on their progress. Eliminating depression isn't going to happen overnight. It's going to take time. Now that sums up how to use behavioral activation. Here are some links to the worksheets that we showed throughout the video, and also our website where we have a whole bunch of more tools, videos, articles, all sorts of things for mental health workers. If you like the video, click below to subscribe to see more like it. Thanks for watching.
Hi, this is Carrie Stevens. I'm a clinical psychologist at the University of Washington.
And this is Patrick Rowie. I'm also a clinical psychologist at the University of Washington.
And Patrick and I are going to talk to you today about skills related to doing behavioral activation with patients, which is an evidence-based treatment for depressive symptoms.
This slide shows our learning objectives for today. The first is to understand the behavioral activation model of depressive symptoms. In other words, how these symptoms develop, how they get maintained, and how behavioral activation can help.